I am your host, Nicole Will, and we're so happy you're here as we navigate the world with your aging loved one. We are here to come alongside older adults, family members, and the senior living community as we explore the world of aging and elder care with helpful resources, informative interviews, and approachable conversation. We get to do this together, so join us on our journey, and this is the willGather podcast. We want to feel confident when we're making medical decisions for our loved one. My guest today is Dr. Brittany Lamb. She is a board-certified emergency medicine physician and a dementia family educator and advocate. When she is in the ER, she experienced a lot of family members needing to make decisions on behalf of their person living with dementia that can even pose greater challenges. It's incredibly overwhelming and stressful as we want to make sure that we are honoring our loved ones' desires. It's important to plan ahead in crisis, knowing what their goals are for care and understanding what does quality of life really look like for a loved one. Dr. Lamb supports families, teaches them the importance how to plan for medical decisions so we can feel informed and empowered and to be confident and have peace of mind when we're caring for our loved one. Today we talk about the importance of that knowledge and education, what trends are happening in the healthcare system and the frustration that we can experience at times, the solution to burnout as a caregiver, what those 4 pillars of planning are. What documents do I need to be aware of and consider in making treatment choices for my loved one? What is medical decision planning and what services are available to support those families? It's important that we invest our time and resources and health, and our loved ones are number one. And what I would have given to have Dr. Lamb's information as a part of my care as we were caring for my grandma. The support would have been invaluable. I'm so happy she's here sharing it with us. Here is my interview with Dr. Brittany Lamb. Hi, Brittany. Happy birthday. It's actually your birthday today, which I feel honored that you would want to spend it with me. So thank you.
Yes, thank you for having me. I'm happy to be here. Any day I can do this type of work and have conversations with awesome people, spread goodness. I'm here for it.
Yeah, me too. One of the things, oh my gosh, when you first said to me, I just want to give a message of hope. And I just feel like that's what we need in the world. And we're always, especially with our loved ones and when we're going through hard times, we are always looking for those ways that we can find hope in our day and in situations. So I loved that you said that. And it just tells all of us, I think, where your heart is and where you're coming from. So yeah, we're going to talk about hope today in a way that talks about medical decisions, which I think is important.
Yeah, I think it's a good thing to consider. There is a different way and a different path.
Yeah, there is. And when you're talking with families and in your work, you're seeing a lot of trends, and I'm sure what families are sharing. It kind of give us like the state of where people are at, why you feel like they're lacking hope, and why we're so frustrated sometimes with the healthcare system.
Yeah, so I think it's difficult one in the dementia space, so I help dementia family caregivers. And in the dementia space, it's really challenging to one, get a diagnosis. The healthcare system is very broken. And so you might think that you can go to your primary care doctor, but then they may not feel comfortable diagnosing someone. Then in your own like local area, there may not be the resources like the neuropsychological testing places to go to and those experts. And then also not realizing that neurologists, not all of them have an interest and a focus in dementia. And so some of them are interested in treating that and managing it, and others aren't. And I just think knowing those nuances between the different providers can be a big sense of overwhelm. You're like, I have a problem. This is a big deal. And people don't know where to go. So that's the first kind of point that I see people struggling with. And then, there's the day to day of being a caregiver and having to balance. It's a whole new skill set that you have to learn. None of us are born like knowing how to react to a grown adult human that is having problems functioning. That's not a child. This person is not a child. Like they deserve respect, and they still need to be able to do what they can do independently. They need support, but there's a different skill set, and a lot of that is how we react to the person.
Mm-hmm.
So I think that's a whole nother search that people go on and feel overwhelmed because they don't know where to go. And then from a medical standpoint, I see people coming into the emergency department. I'm an ER doctor, so I see them come into the ER, and it's just that the looking at what was going to happen in the future and kind of knowing the expectations and the progression of the diseases that cause dementia, it's not really taught or explained. And then if they have other medical problems or they're an aging adult human being, they're going to have other things that happen in their life. And all of those things become more complicated when someone's living with dementia. So I think people experience overwhelm in multiple different facets of being a caregiver, and then just not knowing where to go. And then you Google things and
You're
you
like,
get
where do I even start?
yes, you
Yeah.
Google stuff and you get inundated with all these different places. And it's like, what if this is good? What if this is trustworthy? And does this actually apply to me as an individual in my situation? So that's that's some of it.
Yeah, and we're gonna, I know, dive into even more. So, you are an ER doctor. Tell us a little bit more about you and your background, and so we can understand. And you have such a heart for, especially the dementia community, and where did that come from?
So I've been an attending for almost 6 years now. So after residency, then you're an attending and you're by yourself practicing. So I think that I always knew I wanted to be a doctor. I had no idea what I was going to do. And I fell into the emergency department by a process of elimination. So
Mm-hmm.
I didn't really love any of the rotations that I did in medical school, but I loved problem solving and I loved the idea of going in, doing your job, and then getting to go home, to be quite honest,
Yeah, not
And so
having
that
to
was what was
follow and carry. Yeah.
yeah, because
Mm-hmm.
I am someone that like really feels other people's emotions. And I went through a tough journey when I was actually in medical school. My father was diagnosed with a brain cancer,
I'm so
the very
sorry.
start of my third year, which is when you start all your clinical rotations in medical school. And I think having to deal with that emotional side while I was like developing my professional skills and then looking at what career path I was going to go into, I think it impacted me more than I really realized.
Yeah,
Now in hindsight, looking back, that was, almost 10 years ago.
right.
Or actually, yeah, it was more than 10 years ago.
Mm-hmm.
So it's like, I think that I just fell into the ER because it was a way to kind of turn off some of the emotion, like, and having to actually follow and maintain and have a relationship with patients. Which I do love talking to people. I love connecting with them. And that's my favorite part in the ER, being an ER doctor, is when I know that that person I'm taking care of understands what I am saying. They feel comfortable with what we're doing. They understand what the plan is. I'm like, any questions, comments, concerns? And they're like, no, I think you covered it all. And
Wow.
that is like the best, that's the best feeling to me.
Yeah.
So, but I think when I think about the dementia niche and kind of how I got into this space, it's a personal thing, right? So I had family members that have lived with dementia. My grandmother lived with us when I was a teenager. She had vascular dementia. So it's just always been something that I've had around me since I was a teenager. And then I find that these are patients and people who are very vulnerable, who need, their families need help. Like they need help understanding the decisions that they are making and how those could help or harm the person as an individual.
Mm-hmm.
So I find them very vulnerable, and that's that's kind of why I got into the space. I also selfishly, well, maybe not selfishly, I'm treating my own burnout. So I've become very burnt out by healthcare,
Mm-hmm.
feeling very much like a cog in the wheel. There's so many problems, so many things that are very complicated, and you feel like you can't make a difference sometimes.
Mm-hmm.
So this journey in starting my online business, helping support family caregivers, has really been a treatment for me for burnout. It's helped me tremendously.
Oh, I could see that. And tell us what that is, what you're doing now, in addition to the big job that you already have.
Yeah, so I cut back a little bit at work and I work night shift now. So it's not, it sounds like it would be really awful, really awful maybe, or harder because you're working nights and then alive and working during the day. But
Mm-hmm.
I really liked night shift because I can batch my shifts together, and so then I can have more days off in a row and do this online work. But I developed a course for caregivers, so for family members of people living with dementia who are going to be involved with making their medical decisions. So it teaches them, how to be a medical decision maker, how to determine your person's overall goals of care, because any medical decision that we make has to go back to someone's big goals in their
Mm-hmm.
healthcare. And then I teach, the medical issues that come up with diseases that cause dementia. And then also just because the person is an aging human.
Right.
So I think that we ask people, what do you want? Well, what do you want to do in the ER, in the hospital, in the doctor's office? And if you don't have any information to come to that conversation with,
Mm-hmm.
you're going to be like, well, I don't know. What do you think I should do?
Yeah.
And so what I have created is basically it's just education. It's what we would love to teach you. We just don't have time
Yeah.
to.
When you're in the moment in the ER and all of that.
Yeah, and in
I,
the doctor's office, you get
yeah,
10, 15 minutes.
right.
So I teach all the medical issues that come up with dementia and with aging, what the symptoms look like, how we diagnose them, because that can be more complicated for someone living with dementia. Sometimes we have to do certain testing and the person may not be able to hold still for that testing.
Mm-hmm.
There's nuances with it. And then the treatment options from like most to least aggressive, because everybody has different goals and oftentimes our goals change as the disease progresses. And so I want people to have a place to go where they can get access to all this information and make a plan now, and then they can adjust that plan as things change, through the disease progression.
Yeah, what I would have given to have access to an ER doctor when my grandma was living with us, and then her sister came to live with us, or to the assisted living in our community, and
Mm.
the revolving door that our family had through the emergency room, and then the transitional care unit, and then back to the emergency room, and
Yeah.
not really ever feeling like, okay, what do we do? Like, who can we ask? Who can we talk to? You're right. There's so many questions, and we don't want to be a bother. We're already feeling like, we've got so much on our plate. So I'm just so thankful that you've decided to do this, and I'm excited to let everybody know. And it's like taking that knowledge and education, because as families, we've never been through this before, so we don't know
Mhm.
what we don't know. What are common mistakes that we can make when our loved one is like in the hospital or around medical decisions? What do you wish everyone would kind of know?
Yeah, so I think knowing your person's goals of care is the most important thing. And so when I talk about that, what I'm meaning is how aggressive would they want their care to be, essentially? How aggressive?
Mm-hmm.
And I teach 3 goals of care. So you go from full treatment, which is do everything, including CPR, ICU stays, being on a ventilator, down to comfort care, which comfort care is not no care. It means that we're going to focus primarily, the reason behind the care is to provide comfort, the first
Mm-hmm.
reason, the main reason or intention behind it. So I think that that's one thing I find families oftentimes, it's like it's hard because there's no place for you to go to talk about goals of care, I think.
Yeah.
So it's a huge problem because we wait in society, our goals of care are implied for an entire lifetime, right? And
Yeah.
it's only when we develop a disease that affects our quality of life, or we're not able to make our own decisions, or we need more support, that we start talking to people about what matters to them.
Mm-hmm.
And I believe it's a mistake. Like, I believe that we should be doing this work way earlier, and we should all be talking about what living means to us, what is a good day to us, what gives us quality of life, because those conversations can mean everything for a family in deciding in the moment what they want to do from a medical standpoint. So that's a big deal. That's like foundational work. Knowing who is going to make the decision and how that family dynamic is going to work is something else that you have to start thinking about that ahead of time, because families fight with each other, and they don't. I feel like from a general standpoint, they're not trying to be ugly. But it's emotional, and so they each have their different emotional attachment and relationship with this person that they're trying to advocate for, and that's what they're trying to do in their own way. So having a process for how you're going to make medical decisions, as a family, if that is the situation, is another big thing. And then to be quite honest, we have to do a better job about taking ownership of people's medical problems. So if you're going to be someone's medical decision maker, you need to understand their medical problems and how those things could potentially get worse. affect their quality of life and what the treatments for them look like and how those treatments could affect their quality of life. If you don't really understand the disease progression, you're just going to struggle more, and you're going to second guess when you make decisions. It's just going to be harder. So those are some of the big things that I like to teach and tackle inside of my course. And it's obviously, it depends on the situation in which the family is in. But
Yeah,
yeah.
caters. It's so individualized. I know today we're talking in general broad terms, but of course they can contact you if they really want more of that specific and coursework, and talk about how that big solution to when we feel really overwhelmed and burned out is having that plan. And you've structured it to have different, like 4 different components of that plan. Can you tell us more about that? And then I know
Yeah.
because of your medical background, I'd love to talk more about that medical decision planning
Yeah.
more in detail, but I think having that general idea of what we're looking at is huge.
Yeah, so I think that for any caregiver of any person, not just dementia, I think that when you realize that you're going to have to overtake a lot of decision making for someone and advocacy work for them, I think there's 4 pillars of planning. And I teach in my course, I focus more on 2 of them because I'm not experts in the other 2.
Mm-hmm.
But I tell people about them. I like to talk about them because I think they're so important. So one is legal planning, and that's a bit more time sensitive because if someone's going to lose their decision-making ability, they will not be able to make advanced directives. They will not be able to name a medical power of attorney, and then it's going to get more complicated trying to manage their assets and their
Mm-hmm.
estate and doing a will and all those things. Like that can be very challenging to do. So legal planning is incredibly important. Financial planning is the other thing that I'm not an expert in, but that obviously it impacts our ability to be healthy if we're stressed out about money. And I find a lot of caregivers waiting too long to kind of figure out the financial side of things, and they sacrifice their own future. And I think it's something that maybe is kind of like ugly to talk about. People don't want to talk about it, but you have to think about yourself, because the people behind you will take over your care, and you will trickle down the financial problems. And so I tell people that, like, if you're going to spend money, like that's one of the things that I would spend money on earlier, is if you're going to spend your own money, like coming up with a financial plan for how you're going to manage your person's care is really important. And then the third pillar is mindset. I call it mindset. I'm actually looking for a better term, but it's realizing that you're not on an island, that there are other people that are out there that are dealing with situations like yours, and there are solutions to your problems. And that's like the message of hope that we were talking about in the beginning. I really believe that caregiver burnout is a huge problem, and I really believe that a lot of people in the healthcare industry and other professional industries are also burnt out, and they're looking to take back control and do things on their own terms. And so we're coming online to help you. So you have to know that we're out here, and you have to look for the solution to your problem. Like, people are creating courses and online content and education through their businesses now. So I think that's very powerful. But mindset is asking for help. Anticipating is a big part of it, right? It's anticipating problems so that you can start looking for solutions and help before you need it, before you get into a crisis. Being open-minded to learning is a big part of that. So, and then the fourth thing is what I do. So medical, the medical side of things. If you don't have a way to look forward, and a kind of a plan to follow, it's a big piece of stress that people carry around. They carry around this uncertainty about not knowing, when my phone rings, does that mean I'm going to have to go to the emergency department again? And what are we going to do? And how, and they're going to go back to the transitional care unit, and they're going to go back to the ER. It's very stressful. And so I think having a roadmap and a plan to follow is going to be it's a big deal. I haven't seen a lot of people doing what I do. So I'm happy to be here.
Yeah, we need it. We do. And okay, so we've got to have like what we know of the goals of care. And
Yeah.
then within that, so would you say is that like step number 1, like understanding goals of care? And then like even understanding for families, like what is even medical decision planning? Like what does that even
Yeah.
mean?
Yeah. That's a very good
Hmm.
question. So basically, I think that every person can have an individualized plan for their medical care going
Hmm.
forward. because as we age, we know what emergencies and big decisions people are going to have to make.
Right.
We know what critical care looks like for the most common medical issues that happen. And those are the decisions that cause people most stress. Okay, so decisions that you have to make in the ER, decisions that you have to make in the hospital. And then, of course, whether or not you're going to have surgery, whether or not you're going to do preventative care, whether or not you're going to do screening tests like mammograms and colonoscopies. I mean, there's a lot to it. But I think that when we're talking about medical decision making, it's looking at goals of care is foundational. You have to do that first. You're right. Like that's one of the first things that I teach people, because if you can't make medical decisions without knowing what you're falling back on. The goals of care is it's like what is the cornerstone of a building? When you're building a building, the cornerstone keeps it up. I don't know. I'm not an engineer.
Yep.
It's a foundational piece of work. And then also knowing when the goals of care would change, So, but what I teach medical conditions individually. And then you get to choose what you would pick as far as treatment per each condition that follows your person's goals of care.
That's awesome.
That's medical decision planning, because I'll tell you that just saying, oh, I never want to go on a ventilator, that may be true at a certain point, but there are situations in which someone may want to go on a ventilator in some medical situations, but not in others.
Right.
Like if you have bad underlying heart or lung disease already, and that is what is causing us to say, I might need to put your person on a ventilator, or they may pass away, or they may get worse, versus like, say your person has a pneumonia and we're saying, oh, we can put them on a ventilator to help them recover from this pneumonia. Those are two very, very different things.
It's like that short-term intervention for future health versus this is going to be more of a permanent decision. Is that kind of what you're saying too? Or is like it just varies so differently depending on it?
It depends on the situation. So you're talking about whether or not someone's going to go on a ventilator. Well, in a pneumonia, that's an infection. There's a possibility that person recovers from this infection. But if we're talking about someone having end-stage heart or lung disease, like congestive heart failure, COPD, putting them on a ventilator may be just delaying the inevitable. We know that disease is going to continue to get worse. So it depends on the person, where they are in the journey of their life, what they would decide. And so we can create individualized decision plans, medical decision plans for human beings as they are aging. And I'm just doing this for dementia families because I think that they need it most right now. And this is what doctors should be doing, but we don't have time to do it. So primary care doctors, and then, in the hospital, it would be lovely if we could take the time to do these types of things, but we don't have the time. So I do think that palliative care is a good resource for people who are living with dementia or with a significant underlying chronic disease as they're aging. They do this work like they do. They're not going to have enough time to teach you what I teach inside of my course, because it is hours of content. There's 8 sections to it. So no one's going to spend 8 hours with you, but big picture, that is like what palliative care can do.
Yeah. So, and that's kind of what you're saying is like how it's working now is that families, we go in crisis and then we want all these answers, but our medical professions really don't have the capacity. So something's not working.
Yeah.
It's not working. What else are you seeing right now that you're finding is challenging for people as they're walking into ERs, or things to consider? I think we talked about that revolving door and even the different types of medical decisions, like understanding, okay, this is a big question, understanding paperwork, right? Like, what will an advanced directive give me information to do, or a power of attorney for medical? And so I think also breaking down just some of those weighing questions. Yeah.
I think so there's lots of things people struggle with when they're trying to make medical decisions in the ER. It's crisis decision making, So, but from the paperwork standpoint and like those terms, a medical power of attorney basically is a document that someone puts into place naming a person to speak for them when they cannot. That's what it is. And that's who we call upon when we find that a patient cannot make their own decisions. And in dementia, that usually happens in most diseases that cause dementia. That typically happens in the middle stages of disease. And like for people who know the numbers of dementia and the number staging, we're talking about like stages 4 and 5. So yeah, so medical power of attorney, the person has to have capacity to make that document and put it into place. There are, in each state, there are default medical decision makers by state law. So just because you don't have a medical power of attorney form does not mean that you cannot make medical decisions on behalf of your family member who can't speak for themselves. But that's another thing people can do as far as planning and preparation, is making sure that the points of contact with the hospital are accurate, right? Like, who should we call? And for people who are aging, who have older parents, this is incredibly important, because our parents live independently, and then all of a sudden they need our help, and the hospital doesn't know who to call, and so that's a big point of like planning and preparation, is making sure that that is on record. And then as far as advanced directives go, I think it gets a little bit complicated, and just the terminology. So basically, there's a federal law that says that you are allowed to direct your healthcare in advance. Direct your healthcare in advance, federal law, okay? So you're allowed to say what you would or would not want in advance of not being able to speak for yourself. So different states and different attorneys have come up with different names of documents that do that. So living will is the most common. That's the most common advanced healthcare directive. And usually living wills are very vague and non-specific. So I encourage everyone, if you have an advanced directive, to try to make it more specific to you, put more of your values and goals in there, and then update it. Because I find oftentimes that they're out of date, they're from 20 years ago. The person wanted everything done, and now they have dementia and they're not able to do anything for themselves anymore. They're still like maybe having good quality of life, like still interacting, they still have joy in their life, but they may not make the same choices that they made 60 years or 20 years ago about their healthcare when they were in their 60s. But living wills are the most common, and they're a type of advanced healthcare directive. And then there are other ones, like the 5 wishes is one that people can download. I think it costs $15. But my 2 cents about the living will, the 5 wishes, any directive, is that they're not specific enough. They don't tell me what to do in the ER. They don't say, Dr. Lamb, this is what you should do if I have sepsis. This is what you should do if I have a stroke. They don't tell me that. And so that's why I think that everyone should have an individualized plan for themselves as they're aging.
Yeah. So where do we get the plan that's that individualized? Is that you? That's you, right?
Well,
because it's like, I think because I've got the 5 wishes one, and I've done that, but you're right. There isn't, if we're going to be intentional and specific, it doesn't exist.
It doesn't exist. Okay. So there's no, it doesn't, it's not a thing.
So you would just add your own thoughts to it. Okay.
Well, I think that what people should do, and I've been speaking locally and trying to teach this to folks, is that I think you have to list out all of your medical conditions, right? Every medical problem you have now and what you've had in the past, and you need to become educated about how those things progress going forward and what conditions they put you at risk for. I mean, everyone can plan for stroke. Everyone can plan for heart failure. Everyone can plan for sepsis and pneumonia. There are very common things that happen to us as we age, and so everyone can do that work, but it is like having a framework as part of the challenge. You can do it with your doctor. You can do it with them, but you'd have to tell them, hey, look, I want to have a conversation with you about what I'm at risk for, what big medical conditions you think I could suffer from that would affect my quality of life, so I can start becoming educated about the treatment options and telling my family, like, okay, if I'm living like this on a day-to-day, then I don't want that type of care. That's too aggressive. But I'm okay maybe with like trying care that would prolong my life for a certain period of time. But if it's not getting better, I want you to scale it back. I want you to change my goals and focus more on comfort. So it exists. It exists in with us and becoming educated. So, and I have taught this, maybe if people are interested, they can reach out to me and I can create a little, like a webinar or something on this, like teaching people how to do this for themselves outside of what I do outside of what I do in my course. I mean, you could take my course. I mean, the secondary gain inside of the course is that it's for family members of people living with dementia. So like everything that I teach for dementia, it also can apply to their own lives.
So, with our loved ones with dementia, because they're not always able to communicate with us, are there ways that you've discovered that if we hadn't been fortunate enough to make those plans ahead of time? So, for
Mm-hmm.
giving families hope, if they're like, oh no, I have not done that, I didn't plan ahead,
Yeah.
but there's still some good things that can come out of that. How do we know what can we glean from our loved ones while they're in having their dementia that
Mm-hmm.
lets us know what track to take with their medical care? I don't know if
Yeah.
that question makes sense,
No,
but
that's a good
yeah.
question. Yeah, I think that it's really tough when you haven't been able to have the conversations,
Hmm.
because it then puts more of the, I don't know, the mental burden and stress on you because you don't have that permission and that you don't have that conversation to fall back on. But what I tell people is that, draw upon what you know about this person, what their life has been like, what did they see with their parents, their siblings? Did they ever talk to you about those things? And then talk to their friends, talk to the people that they associate with or that they did when they were, living independently. Talk to those people and try to see what they're, if you're not clear, you want some more backup, I think involving as many people as you can. But I mean, we know our family members, and I think that people, once you become informed, once you know what the options are, I think you'll know what they would choose. And I really believe that. I think that people know what their person would choose. And when you're someone's medical decision maker, you're speaking on behalf of them. But there's a caveat there when people have dementia, and they're not able to speak for themselves, they're also not able to learn and apply the information that's going on right now to their own
Mm.
situation.
Wow. Yep.
So I tell people, remember that your person would be allowed to change their opinion. They would be allowed to grow and learn and take in this information and adjust what their preferences and values and goals are. So I do think the Conversation Project is a really good reference for people. It's conversationproject.org for people looking to have these types of talks with family or prompting yourself to kind of think through this process for your person. But I think just like starting back to quality of life. What does living mean to them, And like what brings them joy? Because people living with dementia, it's not a hopeless situation. They still feel, they can still connect to people in the present moment. Like the present is what they have, right? And so there are beautiful things that come out of that. And it is individualized. It's what quality of life means to that person. So, like for something from like my grandmother, I talked to her about this. She told me that she values being independent. And I said, well, Nana Jean, what happens if you need help? And she said, okay, well, I'm okay having help. I'm like bathing, dressing, feeding, grooming, getting you around, moving you in and out of bed. Yeah, Brittany, I'm okay with that. But I just want to be able to tell those people thank you, or like you're hurting me, or that's too hot, or being able to somewhat communicate your preferences. Like that was very important to her. That was very insightful for me to know. So for her, communication and that back and forth is really important. I think we don't give ourselves enough credit. Like you have to do the work for them if they can't do it for themselves.
Mhm. Yeah, we do. We have to be their voice when they don't have it. That was
Yeah.
you read my mind. That was my next question was like, what do we need to think about in terms of quality of life? And understanding also have you had to have hard conversations when families want to have a lot of maybe medical interventions and the diagnosis doesn't necessarily align with that? That's
Mhm.
where those really, I feel like, hard conversations come in. Or it's
Mhm.
our wishes, right? As loved ones, we want our person to be around forever. So coming to terms with, yeah, the hard stuff.
Yeah, and I'll tell you that's something that I run into a lot in the ER, and it did contribute to my burnout.
Hmm.
To be quite honest, having people that have really significant underlying medical problems that then keep coming into the ER, like you were talking about the revolving door, it's 100% a real thing. Like I've seen lots of family. I've been working in the same hospital system for almost 6 years now, and I see the
Hmm.
same, I see a lot of people repeatedly. Like I have a relationship with them now. You know, I was
Yeah.
trying to run away from that, but it got forced upon me. But no, I mean, it's tough to make decisions in the moment, which is why if you have families, like I just put out blog posts on this recently. Like if you have a power of attorney, how do you get people on the same page in the family when they're making medical decisions? Because I've learned this, that just because there's a medical power of attorney on file doesn't mean that only one person is making the decisions. Oftentimes it's a team, a family, and they self-sabotage themselves in order to make like the decision cannot be made. I cannot tell you how many times I'm like, you guys want me to tell you all the treatment options. We've talked about all the treatment options, like most to least aggressive here right now. Like I need you guys to tell me what you want to do, because it is going to change where your person actually physically goes in the hospital. Like I can't even call to get them a bed because I don't know what we're doing. And because they can't make decisions, the default winds up being that their person gets the maximum medical treatment, usually, or, whatever we've decided upon. Like sometimes I find that people decide in the ER, okay, we're not going to do CPR. So like if this person loses their pulse and isn't breathing anymore, they've decided that if their person's actively dying, they don't want to have CPR or be put on the ventilator. But there's so much more that we can do to people before that happens. And they can't make those decisions because they never thought about that. They never were introduced to those concepts. And then they don't know me. They're overwhelmed and they weren't prepared.
Yeah.
So
And
they can't
emotions
think.
are heightened. We have fear,
Exactly.
and you're like, who is this person coming in?
Exactly. So what happens is if people don't plan, what usually happens is people just get more care. And that's fine if that's what they would want, but a lot of people, that's kind of why I started to have a lot of burnout, is because I'm questioning this. Like, would this person actually choose this for themselves? When I started asking families that questions, a lot of times they'd say things to me like, well, I don't want to let them go. I'm not ready. And I have to be like, look, this isn't about you. Like you were saying, this isn't about you. It's about them. It's about what would they choose for themselves, seeing what has been going on. And it's not just about what's been happening in the ER. It's been what has been happening the past few weeks to months. Like, how have they been living? Like, that's what's important. I know they look really sick and horrible right now. I know this is really scary right now, but like what's been going on prior to this? Like, that's what I want you to think about when we're making decisions, because right now, obviously they don't look well. So it is tough, but I wrote those blog posts and I think they really do apply to all caregivers, and all people making medical decisions. So it's like how to navigate making decisions as a family with a power of attorney named and without a power of attorney named, because I kind of lay out a process that people can follow. Like you need to have a meeting.
Yeah.
You need to have a meeting with the family.
You
I
need to
mean,
actually get together and have conversation about it.
yeah, like you have to ask, like, who wants to be involved? Raise your hand, like, do you want to be
Mhm.
involved? Okay. Do you agree that you will speak on behalf of this person? Like, and how do you logistically do this when I'm calling you from the ER? Like, who comes to the ER? If someone can't come, who's the first point of contact? Like, I can't call six people and ask them what they want to do. So
Yeah.
anyway, I could talk about this
Yeah.
forever.
Oh my
I'm
gosh. No, and I could listen forever. I'm like, this
sorry.
is fascinating. I just feel like when you help families, we just don't even know what even our options are. Like when you were talking about CPR, we think, not being in a medical field, that, okay, that's what we do to life save, but we don't even know to consider there's all these other things we could put in place. And so I think being equipped
Yeah.
with like that knowledge and that information, we just feel more empowered, right? We feel like we can maybe carry less guilt that it's all
Yes.
on our own. And I think that's super important. So, yeah.
Yeah, I think people lose sight of the fact that it's not your fault. Like the disease and the conditions that your person has, that is what has caused this issue. Not you, not them. It's the underlying medical problems, and it's a part of life. Like it is a part of life that we accumulate medical issues, and then we have issues dealing and navigating our everyday lives because of them, and that they affect our quality of life. I mean, it is what it is. Like that is just a reality. And I mean, I think that I have a little bit more of a morbid perspective. I have much more comfortability when it comes to talking about death and dying and suffering because of what I do for a living. I mean, just this past weekend I worked and I like had two people that we did CPR on, and both of them died. And one of them I come find out later on, because I didn't know who they were. We didn't have any identification for this person. They didn't want CPR. Yeah. I didn't know who they were. We had to register them as an unknown person. Eventually we were able to figure out who they were, and they had just been in the hospital and said they didn't want that. And it happened, and the other person, it was an unexpected situation. So, and it was awful. It was sad, but it's, yeah, I mean, I think that the more education and knowledge that you have, it makes you informed. It makes you better able to come to the table in the moment and feel more confident, feel like you're better able to communicate with the care team, because you're not coming in like never having heard these concepts or talked about them before.
Yeah.
Yeah.
Well, I'm so happy that you can do this, and your course is now live, and it's lifetime access. Once people sign up and get in there, then they can, see all that you're doing. And I think it's important. We had talked about like our society now, we pay for access to service and information and resources. That is a common thing. And I think it's also, why aren't we investing in ourselves? This is like one of the biggest things. Our health is number one, and it's important to be able to do that. So there's value in that. And I just thank you. And is there anything else before we go that you want to like leave people with, like a burning idea or thought?
Oh gosh, I think the one thing that I love to say is that, I don't want people to rely on the advanced directives. Use them as a tool, but they are not a plan. So please start thinking about the things that you're at risk for, the things that your person's at risk for. Seek out help, seek out access to information. Like, there are people out here who want to help you. Mm-hmm. And yes, come and check out my website. It's blammd.com. And my course information is on there. You can read my blog and see kind of my take on a lot of these things. And you can join my email list and
find you on social media.
Find me. Yeah. I'm happy to support you.
Yeah. Awesome. And then it's actually applicable for every caregiver and every person in general. Like me being a parent, I always think about when I'm traveling and needing to let people know or what I want for myself. And so regardless of your age, I think it's something we all need to think about. It's important. Yeah.
For sure.
Yeah.
Like talking to your family about what quality of life means to you. Mm-hmm. Oh, that is such a help, I think that's like, we can all do that, and we all should name a medical decision maker. Mm-hmm. And it doesn't have to be your spouse, like just someone who will stick up for you and speak for you on your behalf.
Okay. So. That's good to know. Because I think we go to that, like, it's got to be this person, but it doesn't have to be. Yeah.
They don't even have to be related to you.
That's even better. Oh my gosh. If you've got a person, Yeah,
it just has to be someone who is willing to speak on your behalf. And oftentimes, you don't want to pick someone who's super emotionally attached to you.
Right. Because that's a good point.
Yeah. Anyway.
That's a good point. Oh, Brittany, thank you. And happy birthday.
Thank you. I appreciate you.
Have fun celebrating. And I'm so happy that we've met, and now we'll be able to work together in this space. I think it's really cool. So thank you so much. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.